Hello, my name is Donna Hayes, and I'm a nursing student at the Chamberlain College of Nursing in the master's program working with clinical informatics. What I want to do today is walk you through ambulatory care documentation and really give you kind of a high-level overview of what you need to document and why. What is the difference between an EMR and an EHR? You will actually see these terms interchanged pretty regularly, but there really is a difference. Electronic medical records are just part of an electronic health record. Electronic medical records, abbreviated with an EMR, are an electronic version of the paper chart physicians and other providers used to rely on to house patient medical information. An electronic health record enables patients to have access to their medical records and provides a means to share patient information electronically among providers. The benefits of moving to an electronic health record include the ability to share patient information, which increases efficiency and increases safety by providing clinical decision support guidelines to the providers. Patient information is exchanged using a standardized software code called HL7, or Health Level 7. This standard language can take patient information entered by one provider at one location and transmit it to someone else at another location, even with a different electronic health record. If both providers use the same standard dataset, the information can be recognized and imported into the other provider's electronic health record. This leads to data sharing. Unfortunately, most providers have a large amount of text entries or non-codified data that's not identical to the recipient's data. Not all practices and not all electronic health records use the exact same data. Standardized data sets include using diagnosis and history items associated with an ICD-9 code, soon to be ICD-10. ICD codes are international diagnosis codes. In ICD-9 language, otitis media, an ear infection, has the same code. It's 381. This way it doesn't matter what a provider calls a diagnosis as long as it is associated with the ICD-9 code of 381. Everybody knows how to interpret and can use this information. This is similar to hypertension and high blood pressure. These terms mean the same thing to most clinicians. The computer code, however, cannot recognize that this is the same, and it needs to be associated with a diagnosis code for the system to incorporate it. Along with diagnosis codes, CPT are procedural codes, and those would be the items and things that you would charge a patient for actually doing. SNOMED codes are medical terminology codes that go beyond procedural code and diagnosis codes and actually codified words. And then RX norm codes are medication codes, so that Advil means Advil in all applications and not necessarily ibuprofen. Along with charting a patient encounter, several actions need to be done by the provider to meet meaningful use guidelines. Meaningful use is something you will probably hear for the rest of your clinical career. Meaningful use is a federal incentive program that can pay providers an incentive bonus if they use a certified EMR in a meaningful way. The goal of meaningful use is to increase data sharing with other providers, improve patient safety, and efficacy of treatments. Electronic prescriptions, or e-prescribe, is one example of meaningful use. Prescriptions are ordered electronically by the provider, also known as computerized provider order entry, or CPOE. This avoids poor handwriting and confusion of similar name medications being prescribed and mixed up. This leads to safety and efficacy problems. How many times have we had to call a provider or a physician because we couldn't read the handwriting to administer what they had ordered? This will reduce 100% of that. Electronic transmission to the pharmacy prevents prescriptions from getting lost and the patient not remembering to have them filled. This improves efficacy. Electronic drug screening, when e-prescribing a medication, the e-prescribe system will look at the patient's current medication list and allergy list. If the data was entered in a codified manner, not free text, when those computerized programs take a look at the codified data, they'll make sure the patient isn't on a duplicate therapy and that the patient doesn't have any allergies to the prescribed medication. If a problem is identified, the provider will be alerted. It's key to review the patient history. Before beginning a chart visit note, it is important to review the patient medical and medication history with the patient and make any changes that are needed. This will help ensure the most up-to-date information is available during the documentation process and help improve the validity of clinical decision support messages that may be presented. Free text documentation should be avoided if at all possible, especially for routine or standard patient information. This will improve the likelihood that the data can be exchanged and consumed by another provider using another system. In Second Life, Practice Fusion is the electronic medical record that we have chosen as our test database. So Practice Fusion is an electronic health record solution that is currently certified for meaningful use. So what does this mean? This EHR has the technology to do what physicians require and providers from an EHR to meet meaningful use requirements for stimulus payments. As an example, to meet meaningful use requirements, providers must electronically submit immunizations to an immunization registry. A certified electronic health record will have the technology to record the data and submit it to the immunization registry in the required format. It's up to the provider, however, to enter the information and submit the information to the registry. Another example is recording the patient's smoking history. Meaningful use requires providers to evaluate and record the smoking status of all patients over the age of 13. A certified electronic health record will provide the technology to do this and offer options based on the certification requirements. A certified electronic health record does not do the measures for the provider. Providers should be aware of the requirements and how to appropriately incorporate them into their daily workflow. All of these are meant to improve patient safety, outcomes, and efficacy. So one thing to remember, if you are not an eligible provider, documenting in a meaningful way will help the entire country, not just yourself. Practice Fusion is a fairly intuitive electronic health record solution. Patients can be selected and scheduled using a simple scheduling template. Click on the Schedule button at the top to bring up the clinic calendar, and then click on the appropriate appointment date and time in the grid to enter a patient. To begin seeing patients, you need to create a patient appointment. When the appointment schedule window opens, based on the time that you clicked on the calendar, make sure that the default provider is correct. If not, you can change that provider with the drop-down menu. Verify the time and the date are correct. If not, make additional corrections. And then click in the patient name area to search for a patient. Enter the patient name and/or date of birth to begin the patient search. When the correct patient is found, double-click on the patient's name, and this will bring the patient into the schedule window. Once the correct patient is entered in the schedule, enter a chief complaint. Choose an appropriate type of an appointment from the drop-down menu, a duration, and then click Save. You've now created a patient appointment. When the patient arrives, click on the Appointment tab to search for patients being seen that day. When you find the correct patient, click the drop-down Next to the pending status and change the status to Arrived. You have now checked the patient in. You will see the date become a hyperlink. Click on the date and you will be brought directly to the patient encounter or visit associated with the scheduled appointment. This is an important note. It's important to remember to always take patients from a schedule, no matter what system you're working with. Using an appointment will tie the visit note to a particular date and time associated with the calendar. This is important when billing clinical encounters in an ambulatory or outpatient setting. To create a charge that can be sent to the insurance company, an appointment must be tied to the visit. Providers are able to create patient visit notes without an appointment, and this can become problematic for the billing staff, and a manual link needs to be created to link the two together. When the patient encounter opens, the information entered into the UI, or user interface or screen, will become a chart note that resembles what a provider would have written or typed in a paper chart. In Practice Fusion, enter the vital signs by clicking in each space. Not all fields need to be entered. Practice Fusion has a clinical reminder for patients that are above 18 years old that have a diagnosis of hypertension. This is seen in the clinical reminder area right above the vital signs. If this patient had a clinical reminder, it would display in red and have a 0/1 notation. If you click on the clinical reminder, it will display a message reminding the provider to take the patient's blood pressure. Once the blood pressure is taken, the reminder will turn a greenish color and display 1 out of 1. Taking a blood pressure annually on a patient with a diagnosis of hypertension is a clinical quality measure that needs to be reported during attestation for meaningful use. There are other tutorials here at Chamberlain that explain meaningful use in more depth, but this is a way Practice Fusion is linking clinical decision support rules with clinical quality measures to help providers meet meaningful use guidelines. None of these rules and guides will work if the patient doesn't have hypertension as a diagnosis code in the patient history. The system does not recognize free text entries, so make sure that you're using appropriate diagnosis codes and you're entering information in the appropriate area. Once all vital signs are entered, you can begin the patient encounter using the tabs along the left side of the chart note and beginning with the patient past medical history. After the vitals have been entered, begin the patient encounter by reviewing the patient's past medical history. You'll find the button on the top left corner. Reviewing the past medical history, note that this is a free text area meant for nurses and medical assistants to enter information that may be used as a reference by the provider. Allergies entered here are not used in drug screening while prescribing new medication, so it's not recommended that allergies are placed in this field. Once you've updated the past medical history, continue clicking down the left side of the screen to bring up past diagnoses. You want to click the Add button in the top right corner of the screen to add a diagnosis. I've highlighted this in red. These diagnoses are tied to the ICD-9 code set and are used in diagnosis screening and meaningful use. This is the medication history of the patient. New medications can be added by clicking the Add button. Current medications can be removed by clicking in the hyperlink fields of each medication in the list and then editing from that screen. Medications listed in this section are included in the drug and allergy screening. If the patient does not have any medications, simply click the No Active Medication box in the top left medication list, and it will display that the patient doesn't have any active medications at this time. Okay, continue reviewing allergies, and to add new allergies, you want to click the Add button, or you can simply click the No Active Drug Allergies at this time, or in this case, we're actually going to add some so you can see what the Add button looks like. These add functions and modification screens are identical among all of the different medical history tabs. To add new allergies, we clicked on the New button, and then you can add new allergies by typing in the medication and selecting an appropriate med from the drug table. What you're doing here, we're entering in penicillin, and then when we clicked enter, it listed all of the penicillins that are available in the database, and you need to select one that's fairly similar. The drug screening would be identical for all of these. Once we have a codified medication, then you want to enter the type of reaction experienced by the patient, and in this case, the location would be the skin, the reaction is hives, and the severity is moderate. So you do have the ability of entering something like amoxicillin for a different patient and having the details in the reaction be more of a nausea, upset stomach. So in case a drug screening did occur in the future, you would be able to tell that this was not necessarily an allergic reaction, but maybe an intolerance, and that continuing to prescribe that medication if there's nothing else available would be appropriate. Okay, moving on down to lifestyle brings up the smoking history section. This is a clinical quality measure that Practice Fusion is kind of leading you to, and this is used to meet some of the meaningful use requirements. Smoking status is a clinical quality measure, and the smoking status can be entered by clicking the Add button in the top right corner, just like everything else. So note, the smoking status clinical quality measure requires providers to evaluate the smoking status of all patients over the age of 13 years at least once per year. So after we clicked Add, then we can use the drop-down menu to select a smoking status for this patient, and the effective date will default to today's date, but it can be changed if desired. Once you've finished updating the smoking status, you want to click Save, and you'll be brought back to the clinical note. Entries for the lifestyle can be removed by clicking the red X, and entries can be removed until the note is complete, and then when they're removed after that, if we go back to edit, it will show that the chart note had been edited. Practice Fusion uses SOAP note type charting. To begin charting a patient visit, select the event date, which is in the left-hand side. I've circled it in red, which was typically today's date, and then click the Edit button. A brief refresher on SOAP notes. Subjective, objective, assessment, and plan. So the subjective includes the patient's chief complaint, or why the patient is here. The objective, or the O, are objective findings such as vital signs, the physical exam, and this can include history of present illness, such as the pain has lasted for 3 days. A is the assessment. Typically this is where we are diagnosing the patient. And P is the plan or the orders that you're prescribing for that patient. So SOAP notes combine several types of clinical information into a couple of categories, and this makes the clinical note easy to read. It's important to understand all of the components required for billing a patient encounter and what categories they fall into. There are further educational videos here in Second Life that will introduce billing requirements. After you click the Edit button in the clinic note, the subjective templates used in this practice are displayed. Choose the template matching the patient's chief complaint. For this example, we will use an ENT template if the patient came in with a cough and a sore throat. Once the template is selected, pick the subjective findings from the list to the left. These items are able to be modified on the right pane to match the patient's symptoms. When completed, click on the O to move to the objective finding. So what they're doing by creating this template is they've already typed out the visit note for you, and you're just literally putting it together by clicking on the appropriate little icon. The objective findings include physical exam findings and history of present illness items. The templates that show up now on the left-hand side have changed, and they match objective findings. And they're also still related to the chief complaint for ENT. So you want to continue selecting items on the left side and edit as needed in the note body on the right. When completed, click the A for the assessment. So for this particular patient, we've done a physical exam, we've looked in his ears, we've looked in his throat, and we're documenting those findings. The assessment section is your diagnosis. You can select the diagnosis from the template list to the left, or you can click Add Diagnosis at the bottom of the screen. By clicking Add Diagnosis, you're able to select an ICD-9 code and define the start date for this diagnosis and any other information that you may need. So once you've chosen to add a new diagnosis, you're going to type in on the DX area what your findings are for this patient, and then click Enter. Once you hit Enter, a search will display, and it is a thesaurus search, so you'll notice acute pharyngitis and pharyngitis acute is just a different way of wording this, but the diagnosis and the ICD-9 code are exactly the same. So you just click on the one that's appropriate for this patient. Once you've selected a diagnosis, you want to enter the stop and start date. You may not necessarily know the stop date, but the start date was typically the date that you saw the patient. Check any comments that are required, and then you can also mark this diagnosis as acute or as terminal, and this leads to staging a diagnosis and can also help with meaningful use and some quality requirements. The next step is to click the P for the plan. We have talked to the patient, we found out their subjective complaints, we have objectively looked at that patient and completed our physical exam, we have assessed that patient and decided what their diagnosis is. Now it's time to determine what are you going to do. What are your orders? These can be things such as lab tests, radiology exam, referrals to specialists, and prescriptions. Again, templates will still be displayed that will guide you towards appropriate care based on that chief complaint. And if any of these items are things that you would regularly prescribe or would like to prescribe for this patient, you can click on them. Or if you need to prescribe a medication, you can click Add Medication at the bottom of the screen. And this will bring up a medication window where you can search for the medication you want to provide, enter all of the SIG details, and even attach it to a diagnosis. But remember, this is a test environment, so no medications can be sent electronically or printed from this database. So you don't have to worry about accidentally e-prescribing medication or printing a prescription somebody might get hold of. When the note is completed, or you just want to stop and come back, click the Save button in the top right-hand corner, and the visit can be re-accessed by clicking the Event Date hyperlink on the left-hand side under Events, just like you did to enter this visit note to begin with. Once a visit note has been saved, you can enter the visit note by clicking on the Events tab on the left, selecting the right date, and then clicking the Edit button in the top right-hand corner to make any changes. Once a visit is finalized, changes can no longer be made. Finalization of a visit note will be covered in a later module. Once a visit note has been documented, patient education materials, referral letters, billing and coding needs to be completed as well. These items will be covered in different modules, but remember, this is a training environment, so no patient information is real, and all patients are test patients. So feel free to log into Practice Fusion and take a look around. Practice Fusion also offers free mini web sessions. If you click on the green triangle in the middle of your screen towards the bottom, it will pop up, and they do have some recorded information that may be helpful. Good luck and happy charting!